Around 70% of pregnant women develop stretch marks, and large numbers in other groups, both men and women, will be affected by striae, stretch mark, scarring at some point in their lives. These other groups include teenagers and adolescents experiencing growth spurts, weightlifters, bodybuilders, and anyone experiencing rapid growth, weight gain or weight loss. Stretch marks can occur anywhere, but most commonly appear on the buttocks, breasts, and stomach. What causes these marks? Weight gain or bulking. Irregular weight gain is usually not enough to cause marks, however when the weight gain happens too fast then the skin does not have the time to stretch and will therefore create striae. This also happens when a person does weightlifting. The muscles get pulled with the lifting motion and the constant stretching and expansion puts pressure on the skin and connective tissue resulting in tears and rips and separation. Pregnancy will stretch the midsection of a woman's body and because the enlargement happens at a relatively fast pace and tearing occurs especially in the third trimester. They will not be as noticeable during the pregnancy, but once the child is born and the skin starts going back into place the marks will be more obvious. Muscle gain. People who adopt a high-protein diet and heavy training routines to grow muscles can experience dermis ruptures that lead to stretch marks. In these cases, the ruptures can be noticed in the areas where the muscles have expanded rapidly, not allowing the skin to extend naturally. Loss of collagen and elastin causes the deeper layers of the skin to separate. And, combined with overstretching and tearing, scarring will occur after. Nevertheless, you can reduce their appearance. That's been clinically proven. Inherited genes as well as diet plan are another causes. Inherited genes, type of skin, and diet plans can be some of the causes with regards to stretch marks within teenagers. However generally, fast body modifications are participating. So let's get back to the question of what causes these marks. 2 words, collagen and elastin. Collagen is a group of steroid hormones called glucocorticoids or GCs. That's actually what causes stretch marks. The GCs act on the fibroblasts and prevent them from doing their job. GCs are not all bad. We need them for many things. They are responsible for regulating inflammation, maintaining blood glucose levels and breaking down the fat in adipose tissues, among other things. GC levels are naturally higher during pregnancy and puberty. There isn't anything we can do about that. Excessively high or unhealthy levels do not occur naturally, but taking synthetic GCs, steroids, can and does cause health problems. In the case of some bodybuilders and athletes, steroid use might be what causes stretch marks. Other side effects of steroid use include acne and psychosis. That's what causes stretch marks. Even though we can't do anything about GCs, we can do something to stimulate the production of elastic fibers, which should prevent them. We can also make them go away. Is there a product that can do this? There is. There's a product that can boost the synthesis of collagen production by as much as 90%, as well as reduce the appearance of stretch marks by 72.5%. Feel confident about your body. Get your smooth skin back. Erase your stretch marks problem today. If you need more specific information about how to hide stretch marks or to just get extraordinarily effective stretch mark remedies, visit my website, where I share exactly what anti-aging skincare tips and tricks I use for effective and fast results.